Good morning, guys. A very good morning. Welcome to the part 10 of Neet PG preparation pharmacology class. I think you are going on with your revision. I hope that you have done your revision good. You are reading your notes very well. I think we'll just take the class from here. Previously, we just stopped something with side effects and we will just stop somewhere at antiarrhythmics. Now we'll start with anti-arrhythmic drugs which cause QT prolongation, right? So what are the anti-arrhythmic drugs which cause QT prolongation? This is a very important MCQ for INI-CET, but you will get a question which is indirect. It will be clinical. It will not be a direct question. It will be a clinical question. Now, what are the antiarrhythmic drugs which cause QT prolongation, right? The symbol is for prolongation. Don't think otherwise, right? Don't think like it is some other sort of symbol. It's just a prolongation symbol, right? So, there are two classes, class 1A and class 3. In class 1A, there are three drugs, quinidine, procainamide and diisopyramide. In class 3, you will get sotalol. What is sotalol? It's a beta blocker. Amiodarone, it's a potassium channel blocker. Dronedarone, dofetilide, ibutylide. You remember this drug, ibutylide. I think somewhere we studied about ibutylide, right? We somewhere studied about the treatment of cardioversion with or without ibutylide. Just comment down in the comment section for what condition this is the treatment, right? Cardioversion with or without ibutylide, okay? And one more drug is vernaculine, right? So these are the drugs which cause QT prolongation. You just study it as clear as possible. It's a potential MCQ, right? Now next topic we will go on with further continuation. We will just read something about digoxin. Digoxin is a sodium potassium pump inhibitor. Okay, so digoxin side effects. First we will discuss about the complications that digoxin cause and contraindications where digoxin is not advisable. What is the most common and earliest side effect? What is it? It is simple nausea and vomiting. Nausea and vomiting is the most common and earliest side effect of digoxin. Now rest of the rare things, if you ask me, it is xanthopsia. Xanthopsia means yellow vision. Remember, it will be an MCQ. A patient of age 56 years was treated with digoxin and after a few time interval or a period of time is complaining of yellow vision. What is the most they may not indicate you with this digoxin. They will just give you the condition and they will say that some X drug is given for them and that patient after some period of time complaining of yellow vision. What is the drug given? So obviously it is digoxin which cause xanthopsia. Remember this, it's very, very important. And what are the other side effects that cause hyperkalemia? What is that? Excess potassium levels in the blood, hyperkalemia, and arrhythmias. But if you ask me what type of arrhythmia is most common, if you ask me what type of arrhythmia or what type of condition is most common, then it is ventricular bigeminy. This is most common. And what if the examiner asks most characteristic? What if the examiner asks most characteristics? Then it is atrial tachycardia with AV block. You just highlight this, atrial tachycardia with AV, atriovenous block. Okay. Now, if you ask me the contraindications, what are the contraindications of digoxin? It's simply conditions which increase digoxin toxicity. digoxin toxicity. Okay, now if you ask me what are the conditions which increase digoxin toxicity, I will tell the conditions are KMC in Manipal. KMC in Manipal. Remember this, it's very important. KMC in Manipal rocks. Simply remember this mnemonic. What is KMC in Manipal rocks? K for hypokalemia. K for hypokalemia. Remember these things. K for hypokalemia, M for hypomagnesemia, M for hypomagnesemia, and C for hypercalcemia. C for hypercalcemia, and M, that is in Manipal. M in Manipal refers to myocardial infarction. MI, myocardial infarction. And R in rocks. R in rocks indicate renal failure. Renal failure. Remember this, it is very important. Okay, remember this, it is very important. Now if you ask me further complications, then remember this, it's WPW syndrome. This is very important MCQ, you might get in Neet PG because it's a Neet PG MCQ. Now if you ask me one more condition, it is hyperobstructive cardiomyopathy. So these are absolute contraindications. WPW syndrome is an absolute contraindication for digoxin use. Remember, in WPW syndrome and hyperobstructive cardiomyopathy, we should not use digoxin. And we will think about this statement, what if digoxin toxicity occur? What if digoxin toxicity occur? The antidote is digibind. Antidote is digibind. Clear? Okay, now we will discuss something about RAS. We will discuss something about RAS inhibitors. RAS inhibitors. We will discuss something about RAS inhibitors. What is the first class in RAS inhibitors? ACE inhibitors, angiotensin converting enzyme inhibitors. In these ACE inhibitors, you have to think one thing. All the drugs in ACE inhibitors are prodrugs, except all are prodrugs except captopril and enalapril. Sorry, it's lisinopril. Captopril and lisinopril. Can you tell me what is the active form of enalapril? Enalapril is actually, sorry, I will write here, wait, I will write here outside. Enalapril is actually prodrug. Most of the doctors think enalapril is a active drug. No, active drug is enalaprilat, is active drug. Remember this. So enalapril is a prodrug, but enalaprilat is a active drug. Remember. Okay. So we finish this one. So what are the ACE inhibitors which are actually not prodrugs? That are captopril and lisinopril. All are prodrugs except captopril and lisinopril. Right. Now, what are the side effects of ACE inhibitors? As simple as like dry cough. This is the most common side effect of ACE inhibitors. Okay. Next one is angioedema. Now if you ask me what are the second class of RAS inhibitors, angiotensin receptor blockers. What is the first one? Losartan. I just want to share some facts regarding losartan. What does the losartan do? Can anyone tell? What does the losartan do? So It is a PPAR gamma agonist. PPAR gamma agonist, which decreases insulin resistance. It increases uric acid excretion. So this is the reason losartan is used in hypertension associated with gout. Why? Because it helps in excretion of the urea. It helps in excretion of uric acid. And one more use of losartan is it blocks thromboxane A2. It blocks thromboxane A2. So by blocking thromboxane A2, it acts as anti-aggregant. Okay. Now with this we done this angiotensin receptor blocker. Now we will discuss about direct renin inhibitors. Just 1 minute. Direct renin inhibitors. What are direct renin inhibitors? They are aliskiren. This is very important MCQ that you should remember. But if you ask me, what are the contraindications of all these RAS inhibitors? We will discuss like this. What are the contraindications of RAS inhibitors? First one is pregnancy. In pregnancy, you should not give RAS inhibitors. RAS inhibitors in pregnancy. Next one is bilateral renal arteriostenosis. Bilateral renal arteriostenosis. Next, renal failure. Renal failure is a highly contraindication for RAS inhibitors. Remember, renal failure is highly a contraindication for RAS inhibitors. Okay. Side effects of CCBs. Most of the doctors they make a discussion like, why not we can use CCBs? Why not we can use calcium channel blockers? Because there are some side effects for CCBs. What are those side effects? What are those side effects? Side effects of CCBs are headache, constipation. But this constipation is seen only in verapamil. Only in verapamil. Ankylodema. So it is the complication of CCBs, calcium channel blockers. If ankylodema is observed, what you should do? If ankylodema is observed, what you should do? It can be prevented by ACE or ARB. Now the side effects of CCB, one more side effect is AV block. Now only verapamil and diltiazem show this side effect. Verapamil and diltiazem should not be given with beta blockers. Okay, finish. అయిపోయింది. Just 1 minute guys, just 1 minute. I'll just stop it here. We'll go with next class.